we can save the valuable life of our patients. So when you talk about epidemiology of this condition, yeah, so it takes approximately 35 to 50%. So it is a very common injury. So 1 in 2 patients, yeah, you might come across with what happened, chest trauma. So many of the patients die before hospitalization or admission to the hospital, yeah, which we could save if proper first aid can be given. So we'll discuss about what aids can be given if I think there is some technical problem here, Dr. Cloud.
Can hear doctor, but not the screen, not visible.
Okay, understood. Yeah, there was something. See, we still have students. Actually, the students are still coming in. So there is some. I will close the conference for these people because more people are coming. I don't know, something is happening in between, and then this conference get hanged. So can you all see the screen, right, doctors? Can you all see the screen?
Yes,
Yes, sir.
Everything is clear
yes.
now. Hopefully. So once again, good afternoon to everyone. So today we'll be discussing about chest trauma in detail. Yes. So chest trauma occupies 35 to 50%. Yeah. So 1 in 2 people, yeah, will have this trauma. And when we discuss about chest trauma, a proper first medical aid, yeah, if we could give to our patient, we can save the patient's valuable life. So only we put them into what happened, golden minutes to golden hours. Yeah. So in this time, yeah, if we could possibly render aid, a patient life can be saved, which we will discuss also well in our today's topic. Very frequently what happened, diagnostic error in chest trauma with injuries of internal organs. So we see a very big what happened, diagnostic error also. It's anatomy of chest, thoracic cage or rib cage. Yeah. So we have 12 ribs, yeah, 12 pairs of ribs, yeah, on the which will be named as right or left concrete ribs. Yeah. These ribs will be divided into true, false, 7 true ribs, 8, 9, 10, or false rib because they're indirectly attached to the sternum, and we have 2 floating ribs. Yeah. So in the posterior aspect of this thoracic cage, yeah, we have what, internal intercostal muscle. After that comes your pleura that covers your lung. It's called visceral pleura. The pleura that is going to cover your, it is like a membrane. Yeah, the other part of the pleura that is covering the thoracic wall, it is called as parietal pleura. In between them, we have potential space in which what happen, fluid or air can accumulate. In the bottom, yeah, we have diaphragm. So in the diaphragm, we have concrete outlets through which esophagus exits, inferior vena cava, and aorta exits. These are the 3 main ports. Inlet, we have many structure, yeah, not many structure, including your arteries, yeah, GIT, and muscles and stuff comes out already. So in between your lungs, you have mediastinal space. It is a potential space. Once again, yeah, there we have in the mediastinal space, we have what, vital organs. Yeah, in the pericardial region, we have heart with great vessels. Yeah, that is aorta, pulmonary trunk. Yeah, what happens? So injuries in the mediastinal part, and mediastinal part once again is a dangerous, and it can be also a life-threatening condition. So here we see diaphragm, yeah, so it contracts and dilates in the phase of your respiration. So when you talk about blood supply, yeah, in the ribs, yeah, so we should know already all your blood vessels lie in the inferior aspect. So there is what, in the inferior aspect of every rib, there is a groove for your artery, yeah, intercostal arteries, and the arteries lie pushed in the inferior aspect of your ribs. So only when we do any procedure, yeah, we have to always go above any rib. If you take this intercostal space, we have to make incision above, or we have to make incision above the rib, not below the rib. If you do below the rib, we might damage the artery and it can cause also bleeding. So when we see injuries in the thoracic region, they can be classified as mainly as a form. It can be a blunt trauma or a penetrating trauma. So blunt trauma by itself, it can give different forms of damage to your lung substances. By a blunt trauma, you can have fractures of ribs following what happened, pneumothorax or pneumohemothorax. Yeah, especially if patient had a blunt injury in the right hypochondral region or left hypochondral region, there can be fracture of ribs, following by hemopneumothorax. Plus what happened, it can lead to rupture of liver or spleen, concretely in which direction the blow happened, yeah, which can lead not only thoracic bleeding, thoracoabdominal bleeding, yeah, which is also a very dangerous trauma, yeah. And what happened, condition of the patient, yeah, it will become very critical, yeah. And to save the patient is also, it will be very hard also if proper aid cannot be given. We can't save valuable life of a patient. Next, when we get into penetrating trauma, yeah, so penetrating trauma can be caused because of any sharp object. So we can see here in the picture, yeah, so penetrating trauma can have an inlet.